We tried. Hi, this is Larry Boris from the National Association of Worksite Health Centers. We're going to try to begin the program in another couple of minutes. We want to give people an opportunity to get on board. So if you'll just bear with me a moment, we'll get started shortly. What I do ask though is next to your name, would you please click one of the three dots and put in your affiliation so we know who we're working with and who we're talking about. Also, during the presentation, there'll be opportunities for you to submit questions in the Q&A or in the chat box. We'll respond to those usually toward the end, but if there's something that's really key, that we'll make sure that the speaker will be responding to those as appropriate. So we've got a small group and we will continue to add people, I expect, over time. However, if not, let's just kind of go around the table and see who's doing. So I'll have everybody introduce themselves. So again, Megan, would you please introduce yourself?
Sure. Thank you, Larry. Hi, I'm Megan McHugh. I'm an associate professor of emergency medicine at Northwestern University and a health services researcher. And my research interests focus on the intersection of business and health.
Thank you. Alex?
Alex Lundberg. I am an assistant professor of emergency medicine at Northwestern. I am also an economist, and I am joining this project to help with the statistical evaluation of return on investment or value of investment as well.
Great, thank you. And as I said, we'll go around the table. So Chad, would you introduce yourself, please? Take yourself off mute, Chad.
Sorry about that. I'm Chad Henriksen, and I'm with Northwestern Health Sciences University, a small university in Bloomington, Minnesota. I head up the Worksite Right department, which is an outreach to employers providing on-site health, wellness, injury prevention services.
Great, thank you very much. Catherine, would you introduce yourself, please? Catherine Judson. Take yourself off mute, Catherine. Okay, Susan. Susan Thorne, would you introduce yourself, please?
Good morning, Susan Thorne. I work at Community Medical Centers in Fresno, California. We have a employee health department, but we're interested in starting an on-site, a worksite center.
Thank you. And Bridget Gibbons, would you introduce yourself, please?
Yes, good morning, everyone. Sorry for the late arrival. Wanted to say that I have my own small boutique consulting company, about 25 years healthcare experience, and I've worked with a variety of employers to assess and actually start up on-site or near-site centers. So happy to be here today. Thank you.
Yes, thank you. And again, we'll get started now. So what I want to first thank everyone for participating and let you know that we're going to be recording this and making it available for other people. This is a project that the NAWHC, National Association of Worksite Health Centers, is doing with Northwestern University. And so I'll turn it over to Megan from Northwestern to introduce everyone. Thank you. Not introduce, but introduce the project and such.
Thank you, Larry. I really appreciate the introduction and the opportunity to speak to this really terrific group. My agenda today is really fairly simple. I would like to introduce everybody to the work that we do and our expertise, and discuss this new project that we have under development with the National Association of Worksite Health Centers. And ultimately, I'm looking to recruit organizations to participate in that project, and I'll describe what participation involves and the benefits to companies that do participate. At Northwestern University, I lead a research program on manufacturing and health. The goal of our program is to generate evidence to improve the health of manufacturing workers and manufacturing communities and improve the value of health spending by employers. This program began 5 years ago and has been supported by 3 grants from the Robert Wood Johnson Foundation, a couple grants from the National Association of Manufacturers, and then some funding from a small family foundation. Our research portfolio is really quite extensive. Our studies have explored a lot of different topics of interest to employers and our sponsors. And I just put a few examples on the slide here to give you a sense of how we're spending our time. Over the past couple of years, we have been doing several studies looking at the COVID-19 pandemic, and we've been showing things like, how closure of large manufacturing plants has affected the spread of COVID in the community. We've also looked at the role of employers in terms of promoting COVID-19 vaccination in their communities. We've published a bunch of papers on shift work, looking at the health effects of shift work and the effect of shift work on healthcare claims, because we know shift work has a lot of detrimental effects in terms of chronic health conditions, and ultimately that has a cost for employers as well. We've also looked at the connection between employee health and productivity, and we have been able to demonstrate a link there. And we've conducted a number of systematic literature reviews. For example, we've investigated the strategies that employers can undertake to improve the value of health spending. And what I'd like to emphasize about this work is that these studies really all involved partnerships with different companies. We really greatly value our partners with companies, and many of our research questions have been developed based on our conversation with our partners. And our partners have provided us with access to really terrific data that we've needed to conduct our work. This includes letting us come into their organizations and conduct interviews and focus groups. We've also used a lot of claims data and human resources data. We've established these partnerships through our personal connections, also through Northwestern University has an office of corporate engagement that has linked us to several companies, as has the National Association of Manufacturers. So to date, we have worked with 40 companies, the vast majority of which have been large employers. And, we take these partnerships very seriously. We always establish data use agreements whenever data are being transferred between the companies and Northwestern. They specify the confidentiality of our participants, meaning that we never share the names of the companies that we work with in any of our reports or publications. However, the participating companies are free to disclose their participation in our studies. We also have a very high level of data security to make sure that any data that we collect from companies are secured and protected as well as they possibly can be. And our partners always have the opportunity to review our reports and publications, to help ensure that we are in fact keeping their names anonymous. So our partners they always really see our findings months before they become publicly available. Now, one area where we have not yet conducted any work is on worksite health clinics. But because we work with a lot of large employers, many of them do have on-site or near-site health clinics. And the health benefit leaders that we speak with very frequently report that their worksite health clinics are really a key component to their strategies for improving the value of health spending. So anecdotally, we hear a whole lot about the benefits of worksite health clinics, and we know from surveys that they are expanding in numbers across the country. Nevertheless, my colleagues Dave Liss and Alex Lumberg and I have reviewed the literature and haven't found a whole lot of evidence in the public domain with really good empirical findings about the quality of care provided in worksite health clinics and the savings to companies regarding worksite health clinics. So we believe there's really an opportunity here to learn from worksite health clinics, particularly since other sort of newer models of healthcare, particularly those that have been run out of the Centers for Medicare and Medicaid Services, have really shown underwhelming results. And so we think that there may be some elements of worksite health clinics that are key to their success and potentially transferable to other primary care settings. And so to that end, we are in the process of developing a new study on worksite health clinics. The study that, as we are envisioning it, would be the largest evaluation of worksite health clinics to date. We would aim to describe how employees and their dependents are using worksite health clinics, whether it is used as a substitute for community-based primary care or a complement to community-based primary care. We also want to look at the quality of care provided in worksite health clinics. We would like to take a look at the value of investment to employers. And then ultimately, we want to identify the features of worksite health clinics that are most strongly correlated with success. Again, to get at these lessons learned that may be transferable to other places. And so we are in the process of designing this study right now. So here on this slide is my colleague, Dave List, who's also on the call today. Dave has expertise in evaluating primary care interventions, as well as quantitative methods, and he's going to be our team lead for the quality assessment. And so the goal of Dave's work here is to examine changes in healthcare quality attributed specifically to worksite health clinics. And our approach for conducting this work really, we recognize, needs to be flexible and is somewhat dependent upon the setting and the data available. For example, one outcome of interest to us is likely to be receipt of recommended screenings. However, we also want to focus on the outcomes that are prioritized by the companies. If a company is, setting up its worksite health clinic with the idea of addressing musculoskeletal issues or diabetes, those are the outcome measures that we want to focus on as well. Now, doing this work is quite a bit of a challenge from a statistical standpoint, in part because we need to find a good control group. And again, in terms of identifying the control group, we really need to be flexible based on the circumstances of the participating companies. Ideally, we will recruit companies to participate in this study that have multiple worksite health clinics. And if they rolled out those clinics at different points in time, we can use the company's own workers from other sites as controls, essentially comparing quality of care provided to the workers from the early adoption sites to the quality of care received from the later adoption sites. And if we don't have participating companies that rolled out worksite health clinics at different times, but the company has one site with a worksite health clinic and one site without one, we can compare workers with the on-site health clinic with workers that don't have access to the on-site clinic. And there are also other options as well if we have company partners whose context really doesn't fit either of those scenarios very well. Additionally, with this quality assessment, we also want to look at the relative performance of worksite health clinics during the pandemic compared to community-based primary care providers. We know in community-based primary care, recommended health screenings really declined during the pandemic, and they haven't reached the pre-pandemic levels even still today. And we suspect that this might not be the case for worksite health clinics. So we want to make a comparison between worksite health clinics and community-based providers regarding recommended screenings during the pandemic. And the financial assessment of this study will be led by my colleague, Alex Lumberg, who is an economist. He will be describing differences in healthcare utilization patterns between workers that use the clinics and workers that do not use the clinics. He'll also be estimating the differences in annual cost of care for clinic users versus non-clinic users. And we'll be able to control for differences in the characteristics between those two groups of employees using statistical models. we're going to make similar decisions about control groups for the financial analysis that we will for the quality analysis. We also plan to identify which treatment areas tend to be most cost effective in the clinics. Again, the focus of this analysis is going to vary a little bit depending upon the company's focus within the clinics. You know, if the company, again, is interested in musculoskeletal or diabetes, those are some of the areas that we can use to look at whether the treatment areas are more effective, more cost effective in worksite health clinics compared to other places. And then I'll be leading this third component of the evaluation, which aims to identify the attributes of worksite health clinics that are correlated with success. This third component will be based largely on qualitative data, so interviews with the people who know the worksite health clinic best. You know, representatives from human resources, the staff within the worksite health clinic. If the clinic is run by a third-party vendor, we want to interview those folks as well. And these interviews will really allow us to understand the characteristics of the clinics better, and they'll allow our research team to make assessments about how those characteristics may facilitate or hinder performance. They'll also help guide us in terms of, you know, what quality outcomes or what quality measures to really focus on. And then we're going to quantify our assessments and calculate the correlation between the characteristics of our outcomes from the quality and the financial assessments with some of the characteristics that we learned about through the interviews. So ultimately, this analysis will help us to understand the ingredients that may be key to success for worksite health clinics. For example, they may be staffing patterns or convenience or the list of services offered. And some of these things, again, might be transferable to other community-based primary care settings. To support this study, we will be writing a grant to the Agency for Healthcare Research and Quality, which is an agency within the Department of Health and Human Services. We believe that this evaluation of worksite health clinics aligns very nicely with the mission and the priorities of ARC. Our grant application to the Agency for Healthcare Research and Quality is due in early October. But developing a federal grant application is very labor intensive, very time consuming. So Dave and Alex and I are working hard on this now. So we are looking to identify our partners as soon as possible. And one of those partners that we're very grateful for is the National Association of Worksite Health Centers. They will be a subcontractor on this project, and Larry has been most helpful in terms of making this project happen. So in terms of recruitment, we are seeking to work with 4 companies. These companies must have at least one worksite health clinic that provides basic primary care services, or at least basic primary care services. And in terms of recruitment, we want to prioritize working with company partners that have multiple clinics and companies that have some worksite clinics without, or excuse me, have some worksite locations without a clinic. We would also prioritize working with companies that have at least one rural location and a large share of workers who are underrepresented minorities. And this is really aligned with ARC's priority population. This isn't a deal breaker, but we know that our sponsor likes to see, you know, work being done in rural areas and with underserved populations. So to the extent we can find sites that match those descriptors, all the better. So we can offer participating companies the following benefits. First, we can provide company-specific reports describing results of our quality and our financial assessments. Specifically, these reports will show the effect of worksite health clinics on process and outcome measures. You know, these are the quality measures that we'll be looking at. Recommended screenings during the pandemic, total cost of care, and again, cost-effective areas of treatment. We will also provide participating companies with a comparison report for another company so that participants can see how they compare to others. Because we do promise all participants anonymity, The comparison report will be anonymized. So, if you decide to participate, we will give you results from another company, but we won't identify that company. And then, of course, we will conduct a briefing of results for company leaders at their convenience. Overall, we're really aiming to provide our participants with results that offer them a fresh look at the data on their worksite health clinics. So in terms of what commitments to participate means, first, we ask that our company partners participate in some meetings. So we would have a 2-hour on-site meeting in the company site planning meeting to kick off the project. Additionally, I would conduct one-on-one interviews with the key stakeholders. Each interview would last approximately 1 hour. Next, we really do need access to data. We are looking for at least 5 years of individual or employee level medical and pharmacy claims. Again, that's over 5 years. We are not interested in collecting any protected health information. We don't want to know the identities of any individuals. But we do need this individual level claims data that we've worked with in the past, and we can help the company along in terms of how to transfer that data and provide assurances in terms of keeping those data secure. And then finally, we ask that each company identify a liaison who can serve as our point of contact as we set up our data use agreements and as we establish the transfer of data from the company to Northwestern University. We anticipate this person would spend about 3 hours per month, working with us over a period of about 18 months. And we understand that that is a lot to ask of a company. So we do have a small budget to assist with any expenses and to remunerate that individual who helps us along with this study, up to $5,000 per participating company. Additionally, this project involves, as I mentioned, a partnership with Larry and the National Association of Worksite Health Centers. Specifically, we are going to set up a subcontract with Larry. We have asked that the association provide us input as we move forward with the evaluation. Specifically, Larry and his team will assemble an advisory panel of members who would meet with us periodically, at the start, midpoint, and at the end of the study. The association would convene this group, and we would seek their feedback on our progress and our preliminary findings. We would also ask that the association assist with dissemination efforts, and I would welcome, the association's ideas in terms of the best way to go about disseminating our findings. So that is our project in a nutshell. I know I just threw a lot of information out there, and I'm happy to address any questions or comments about the study. So thanks again for your time.
Great, thanks very much, Megan. So what I want to do now is go around the table and ask everybody on the call for comments, questions, suggestions, or any other observations you have relating to this. There's no commitment here required, but it's an opportunity to get thoughts, and then we'll follow up with anyone who particularly wants to. So let me start out just listing the people that I've got. Bridget Gibbons. Bridget, any comments, questions, thoughts about your organization's involvement?
Well, thank you so much for the opportunity. It sounds incredibly compelling, and hats off to Northwestern and the initiative led by Megan. I'm sure as I have an opportunity to absorb it a little bit more, I'll be happy to come up with questions. And I'm assuming, Larry, you wouldn't mind if those get emailed to you directly post-seminar. But I'm already starting to think about clients that I have had that might meet the criteria for participation. And in particular, I'm thinking about the control group. But again, what I'll do is I'll formalize my questions to you directly, Larry, post-seminar, if that's acceptable.
Yeah, that'd be just fine. No problem at all.
Terrific. Thank you very much. I appreciate the opportunity to just kind of absorb it a little bit and be fully engaged. Thank you.
Great. Thanks for participating. Chad Hendrickson. Chad, your thoughts?
Yeah, I'll follow up with Bridget as well, right? And the fact that I might need a little more time to put it together here as far as an educated question. That being said, this is a great project, and we champion your efforts as well. I guess maybe one quick question as I think of some of our accounts, and we have in one in particular, I think that might fit some of the criteria that you've talked about here, Megan, is a company of about 6,000 employees that has 26 different sites. And we have on-site clinics at 3 of those currently, and we're looking to expand that, but they would have a control group, right? And again, some of these are in rural areas. They certainly have a different employee populations that are underserved. Those types of things are all in place. So my 2 questions is that we provide on-site chiropractic care, and in most states that's considered primary care, but I'm not sure if that fits your model or not. And second of all, with 26 sites, they typically will average, 250 to 300 employees at each of their sites that we're at. Does that fit your criteria?
So let me take the second one first. So smaller sites are fine. So 250 to 300 employees at a site with a clinic would be fine. It would be on the smaller end of the spectrum, but do the clinics also take spouses and dependents? Because then those numbers might rise a bit.
Currently, our 3 sites do not. One of the sites is transitioning to be able to do that, and future sites that we're looking at would accommodate dependents who are. The conversation has been dependents who are under their benefit plan.
Mm-hmm. So we would be interested in including essentially anyone 18 and over, even if it wasn't an employee but a dependent. So I see this as being a very reasonable site, especially as it has some rural locations, some underserved locations. I think that in many ways would be quite ideal. Your question about chiropractic is an interesting one, and so. If it is a site that only provides chiropractic, I don't know that would be a perfect fit, but if it provides primary care plus chiropractic, I think that would be terrific, and we could potentially look at chiropractic outcomes, at your site compared to other sites.
Very good.
Yeah, and just as a side note, Megan, we work with the Foundation for Chiropractic Progress that has done a lot of work in worksite clinics. And so that could be a side group for us to talk to on that. Susan Thorne. Susan, thoughts and comments?
Yeah, fascinating work. As a fellow researcher and a nurse, I'm very passionate about primary care and public health outcomes. I don't think my current organization would meet the criteria for your study. But I guess one of my questions is we're an organization of more than 9,000 employees, and we've got another 3,000 providers. We are affiliated with UCSF's School of Medicine, but are you aware of any of this same type of work that either has been done or is ongoing for healthcare organizations? And I mean, specifically during COVID, I've seen the impact on our employees for routine healthcare and outcomes. So thoughts?
Yeah, so my thought is that we haven't seen a lot that's focused specifically on on-site and near-site health centers, which is one of the motivating factors for this particular study. There has been some work looking at single sites, particularly, some elements of patient-centered medical care or patient-centered medical homes being adopted into worksite health centers. But aside from that, there just doesn't seem to be a whole lot out there on worksite health centers specifically, which is not to say that it hasn't been done. I'm inclined to think that many companies with worksite health centers have taken some time to evaluate their metrics, whether they're financial or quality, but they don't necessarily end up in the public domain, and they perhaps aren't evaluated in the most robust manner. And so that's really where we're trying to make a difference here.
Right. Thank you.
Thanks very much. Andrew Tapia. Andrew, I don't know if you were in for the whole session, but any comments or questions that you've got? Let me allow you to talk there. Go ahead, Andrew. Andrew from Cisco, any comments or questions there? All right, let me move on. Diane Felix, Diane from Stanford. Any comments or questions, Diane?
I'm sorry, I joined in late, so I missed the first part, but it sounds very interested, and I'm really interested in learning more. So maybe I can touch base with Megan or with you, Larry, later to just kind of get up to speed with it. But it sounds like a great research project.
Yeah, we're recording this session, and so we'll send it out to everyone. And after you review it, then feel free to contact us or submit any questions you have.
Great, thank you.
Sure, Greg McNair. Greg, comments or questions?
None at this time. Thank you.
Okay. Kathleen Johnson, Caitlin. I'm sorry, Caitlin. I don't know if you've had a chance to sit in on any of this.
On mute. Hi, can you hear me?
Yes, we can. Sure.
Okay. Took me a while to find the unmute button. My team and I had the wrong link, so we're all literally joining now. I'm in the room with sorry, Andrew.
No problem.
Andrew Tapia. And you may see Eileen join and Lindsay join, and Ann. We're all Cisco. And we're also late because we were struggling to find the right link. So we missed the introduction. We apologize. Just as a quick overview, we have comprehensive on-site patient-centered medical home, multidisciplinary health centers in San Jose, California, Research Triangle Park, North Carolina. We also have a similar site in Bangalore, India, and we have relationships with crossover with a near site clinic in San Francisco. We're looking to expand that model to other states. And then we have an occupational health site in Mexico, which is an occupational office, if you will. So we also study our performance quarter over quarter, year over year, using operational metrics, clinical metrics, but also claims data. So Work Partners is our data analytical team that helps us generate many studies to evaluate our program's performance. So we appreciate being included in this conversation.
Well, thank you, Caitlin. And I appreciate the description and overview of your clinics. You know, it seems to me that Cisco might be a really nice partner for this evaluation. And if you're interested in doing so, you know, I'd be happy to have another call with you and your team, and we can get into the specifics a little bit more.
Perfect. Yes, we are interested. Absolutely. And I'm so sorry, we completely missed the introduction. So we're not quite sure what we're totally interested in, but absolutely.
Yeah, and as I said, there's a recording of this, Caitlin, that we'll be sending out to everyone. So you could review it. But Megan and I have had individual calls with other companies who couldn't be on this. So we're happy to do it, if not immediately following this, if that works for you. Otherwise, after at a time of your convenience. Megan's still teaching classes, so we have to make sure that she can get in that as well. Great, thanks. Let me move on. Lindsay Rittmuller. Lindsay, comments or questions?
I'm Lindsay Mueller. Sorry, I had trouble entering as well. I'm with Work Partners. I did miss the beginning, but I am an analytical advisor and analytical consultant for Cisco via Work Partners. Do a lot of on-site health center and analytics for them around PCMH models and match cohorts. So happy to be here.
Great, thank you. Lori Nettie. Lori, I don't know if you're in with Martha Shepard and Dave Hines, but anyone from the Vanderbilt or Metro Nashville School District want to comment or have questions as well?
Hi, Larry. Yes, I work with Dr. Shepard and David at Metro Nashville Public Schools, the on-site clinics there. Interesting work. We definitely look at our quality measures routinely. And I would just, we would talk internally and don't really have any questions myself at this time.
Okay. Martha Shepard, comments or questions?
Well, we've had an opportunity to talk with Megan a little bit already. I think it's a great project. We're really excited. It's an important work.
Great, thank you. Phil Burns, Philip, comments or questions?
Hey, I think I'm one of those that was tardy coming in, so appreciate your patience there. No, I'd really like to review the recording and then have a clear understanding of the profiles that are going to make sense for the study. We manage a couple hundred employers, and so it's a matter of who might we want to work with. So look forward to seeing the recording. Great.
Okay. Thank you very much. Anybody else have any comments or questions? Martha, David, your thoughts, be glad to continue to do this. So let me ask Alex, any comments from your side, or David from Northwestern?
Sorry. I have no additional comments, Larry. I came late to the party. It sounds like it went well, though, with a lot of good positives there. So I defer to Martha and Lori.
Okay. David Liss, any comments, or Alex, any comments for the group?
Sure. First, let me just echo what Megan said, and thanks for everyone for your time, and nice to virtually meet you today. I would just say, just to sort of reiterate a little bit of what Megan commented on about, although we have these sorts of criteria and sort of desired characteristics of some of the these participating organizations, there certainly is a degree of kind of flexibility in terms of our ability to do these evaluations. And let me echo that every study is different, every organization is different, and that's sort of the fun part for us in getting to wrap our heads around what these organizations are doing, learn about what they're attempting to do, and then sort of designing our evaluation accordingly in the most kind of rigorous way possible. So again, thanks. Nice to meet everyone.
Great, thank you. And go ahead, Alex.
So I was about to echo the same sentiment with the flexibility. We understand that different organizations might have different objectives with the worksite health centers, and we do have a variety of potential statistical techniques at our disposal. It may be that the analysis for one organization and worksite health center looks very different than the analysis for another organization as well, and we're prepared for that.
Great. Megan, could you again clarify if an employer or organization has just one site in a region, but has the size and the data and the trend and the experience, would they be eligible to participate?
Yes. So the minimum requirement is essentially at least one worksite health clinic or near site health clinic that provides at least basic primary care, and that is willing and able to provide us with individual level claims data.
Okay, that's great. All right, well, with that, again, let me thank everybody who participated. I apologize for those who got the incorrect link and couldn't come in early. We will be sending out, or as I said, a recording of this to everyone. And if anybody wants an individual call let me know, and Megan and I will schedule that with you and your organization at a time of everyone's convenience. So with that, thank you all for participating in this orientation call, and hopefully you all participate as well in our annual forum, September 8th and 9th in Nashville, Tennessee. Thanks again. Thanks for Northwestern staff and everyone else for being on. Have a good, safe day, everybody. Bye-bye.
Thank you. Thank you very much.
Thank you.
Thank you.